Hello everyone, I am Keyuri, a third year physiotherapy student, and I am going to present a topic which is stages of menopause. So now, what is menopause? It is permanent cessation of menstruation due to loss of ovarian follicular activity. We can confirm it retrospectively only after 12 consecutive months of amenorrhea with no other cause. It is defined by WHO. Then climacteric, the broader transitional phase during which the ovarian function gradually declines. Now, what are its types? It can be naturally or it can be induced due to oophorectomy or chemotherapy or radiotherapy. Now, premature menopause occurs before the age of 40. So, the typical age range of menopause will be 45 to 55, 51 is globally, and 46 to 47 years in Indian women. Now, why it's important? Why it's important to know about it? Because first of all, it is a third of life in women's lifespan. It is increased life expectancy means women spend nearly a third of life in the post-menopausal phase. Second, as the menstruation will stop, it will affect hormonal levels, and furthermore it will affect the multiple system. As example, estrogen withdrawal will affect the cardiovascular, skeletal, urogenital, metabolic, psychological systems. As systems will be affected, long-term risk will occur, like osteoporosis, cardiovascular disease, and urogenital disease like atrophy. So, to prevent it or to be precautious, we need to understand it, and for that, we can do timely screening, counseling, HRT decisions, and here physiotherapy role comes as well. Now, what are its signs and symptoms? How do we recognize it? So first of all, vasomotor symptoms will be there, hot flushes, night sweats, palpitations will be there. Psychological symptoms are mood swings, anxiety, depression, insomnia, poor concentration. Then urogenital will be vaginal dryness, dyspareunia, urgency, recurrent UTIs, stress incontinence will be there. Musculoskeletal symptoms will be joint pain, myalgia, accelerated bone loss. Then in menstrual, oligomenorrhea can occur, occasional menorrhagia during transitional phase can occur, and sexual and others will include reduced libido, skin changes, hair falls, gray hair, weight gain, altered lipids level will be there. Then what are its stages? So it has 4 stages mainly: premenopause, perimenopause, menopause, and postmenopause. So premenopause is reproductive years. So regular cycles will be there. Then perimenopause, it is transitional period. So irregular cycles will be there, all signs and symptoms will be there, and fluctuating hormones mainly. Then menopause period, we can confirm it after the perimenopause at after the 12 months perfectly. Then after the menopause, post-menopause will start, which is mainly a 2 to 4 years, or it can be 2 to 8 years, which is life after the final menopause, the last period. So estrogen and FSH levels during the transitional phase will be there. So estrogen will decrease at the end and FSH will increase at the end. So these are the hormonal differences in levels during the phases. Now first one is perimenopause. After the premenopause, it is the transitional phase, begins with first cycle change after the premenopause, like regular cycles. So it is divided into early transition and late transition. So in early transition there will be cycle length varies by 7 or more days from normal because it's early, it's initial stage. Then ovarian reserve and it will inhibit decline of FSH starts rising. So ovarian reserve and inhibin will decline, and due to that FSH starts rising. Then earliest vasomotor symptoms may begin due to the completion of premenopause. Then fertility will be reduced but pregnancy still be possible because it's early transition, but it will not happen in late transition. So it is more than 60 days of amenorrhea between cycles. So then vasomotor symptoms, hot flushes typically intensify unlike in early transition. Then involuntary cycles increasingly common unlike in early transition, and then contraceptive advice still clinically relevant as it was possible in early transition as well. So perimenopause is where symptoms vary most widely between women. So making patient education and individualized physiotherapy advice especially it is valuable as it will affect the most in this phase the lifestyle and living condition. Now menopause. Now as we discussed earlier, why it is retrospective. First of all, it is the date of the final menstrual period. So on that day no one can know it was the last one. It could simply be a skipped cycle also. The only way to confirm it was final. Wait and see no period follows for 12 consecutive months. Diagnosis therefore retrospective. We can only know it after 12 months. The date is backdated to the last period even though it is only confirmed a year later. So this is why menopause is single point in time while perimenopause and postmenopause are surrounding phases. Postmenopause and global staging. So it is divided into early and late postmenopause. So early is roughly 5 to 6 years and late is following the early years. In early phase there will be most rapid phase of bone loss, vasomotor symptoms, peak in frequency, estrogen settles at consistently low levels. So estrogen levels is opposite of FSH in early postmenopause. Then late will be vasomotor symptoms gradually subside unlike the early postmenopause. Then urogenital atrophy, osteoporosis risk continue rising as it was in early phase as well. Then cardiovascular risk climbs after the vasomotor symptoms and estrogen settles. So long-term surveillance is essential in late one. Now STRO plus 10, it is the international classification for the menopause by doing simple steps using cycle patterns and hormonal blood test. So first will be reproductive normal period, then early transition will happen, then it will cause slightly irregular periods, then late transition skipped 60 plus days, then menopause the final period, then early and late postmenopause first 5-6 years, and then late one will be new normal. Now it's physiotherapy relevance. What we can do to change its signs and symptoms or prevent it and maintain a healthy lifestyle. So first of all, for urogenital atrophy and stress urinary incontinence, we can do pelvis training or pelvic floor muscle trainings. Then for osteoporosis prevention or musculoskeletal symptoms, we can do weight bearing exercises. For posture correction, back care for musculoskeletal symptoms. Then for cardiovascular symptoms, we can do aerobic exercises to offset rising severity risk. Then for hot flashes, anxiety, depression, overthinking, we can do relaxation and breathing. For muscle dysfunction, we can do biofeedback and coordination as well. Then for education and group exercise, we can do promoting active exercises, recreational activities. It is for healthy aging as well. References are DC Datta's textbook of gynecology and Mental's physiotherapy in obs and gynae. Thank you.